Okay, so I think we're live. Hello, Dr. Gary Gruber. Um, I hope everybody's on and able to join us. This is Jenny Rush. I'm from Lyme Thriving, and we are doing something a little bit differently this week. We usually have teleconference calls, and we discuss a variety of topics. We focus a lot on the spiritual and emotional aspect of dealing with chronic illness. And we are very fortunate to have a number of healthcare providers who have been our guest speakers who come on to support the Lyme community with their knowledge and their wisdom about how to take care of yourselves in dealing with chronic Lyme disease and co-infections. And tonight we're doing something differently. We decided to do a video broadcast. So we're very new to this, and it's been a little exciting getting it started. A few bumps along the way. So just bear with us if we make any errors. It is being recorded, so if for any reason you aren't able to see us, the video will be posted later this evening once we're completed. So tonight, our guest is Dr. Gary Gruber. He is a naturopath here in New Canaan, Connecticut. He is a previous guest speaker on our calls at least 3 times and has just been received really wonderfully, and he's been a great help to many people in the community. So Gary, welcome back to being with us, and we're very excited. Thanks for being prepared to try a new format with us.
I'm glad we're doing this. You know, this is one of my goals, is to be able to do these kind of broadcasts. And one of the things we might want to do is make sure that the question feature is turned on. So if people are watching right now, they might want to just ask questions.
Yeah, let me see if I can.
I think there's a Q&A box. I've never, this is all new to me. We are definitely trudging through new territory here, and it's great because if this works, then I think other practitioners, other people are going to be able to expand the quality of these kinds of presentations to the group.
Right. I think I have the Q&A enabled. So what I did though in advance, just in case I completely messed things up and was not able to figure out how to enable the Q&A, was, as you know, I got people to submit questions ahead of time.
Sure.
Our topic for this evening is intestinal health, and I know you were going to spend a bit of time focusing on irritable bowel syndrome. So I have a number of questions. I did send you a copy of the list. I have a couple of extras that I added to it since I've sent it to you. And so I'm going to let you share your information with us, and
okay.
Then once you're completed with that, I will go through the questions, and we'll see how we're doing for time, and then
okay.
if there's leftover time afterwards, if we've got the Q&A thing working right, people can post questions, or if they have a follow-up question to something, we'll just see how it works.
Okay, so let's get started. Make sure you'll let me know if it's not turned on properly. So what I need to do is share my screen with you. So
Okay.
let me make sure that I get that going. Okay, so share. So you can hear me, and you should be able to see the screen. Intestinal health and Lyme disease.
Yes, I can see that just fine.
So these are the 4 areas that I'm going to try and cover tonight in a few slides. I've been working on a new project concerning a condition called Irritable Bowel Syndrome, and this is kind of a takeoff from those slides that I did on our website called irritablebowelremedies.com. So it's really the first time that I'm doing something like this consecutively. It's been done on our videos in little bits and pieces. So I'm trying to put everything together in one presentation, so everyone who's watching this is going to see it for the first time. So I'm going to speak about the the digestive function and its components, the symptoms of irritable bowel syndrome. So I'm going to really focus and hone in on that. One of the things about irritable bowel is that there's an enormous number of people in the community, in our culture, who have this condition. They're estimating that it may be as high as 20%. So between 15 and 20% of the people out there may have this condition. So it's very, very common, and I think that the digestive system is really the core for all kinds of conditions, and including Lyme. Many of the patients that I've worked with have had chronic digestive problems, and so I think this whole topic is very, very appropriate to talk with respect to Lyme disease. I'm going to cover the obstacles to healing, and then lastly I'm going to put together a model for everyone on treatment. I'm not going to have the time to discuss specific treatments for specific people, but I'm going to put together for everyone a kind of a model that you can follow. So let's see. So the digestive system is a complex of organs with multiple functions. The digestion, which is breaking down of food into its basic nutrients. Absorption, the taking up of necessary and specific nutrients into the body. And then one of the functions of the digestive system is to provide a barrier. And this barrier prevents unwanted substances and infections from getting into the body. Also, and this has been said many, many times, the digestive system is the major system for your body's immunity. It's essentially a warning system that tests and prepares antibodies that act against foreign particles like viruses, bacteria, and other parasites. There's also a function called biotransformation, and I'm going to go into that a little bit. Biotransformation means taking a toxic substance and making it water soluble so it may be eliminated from the body. Essentially, anything that you absorb into your body, whether you breathe it, drink it, eat it, if there's anything toxic in there, it has to be biotransformed in order to come out. It just doesn't pass right through, in and out. It has to be transformed into another substance. And lastly, the last function is elimination, the elimination of waste products, of metabolism, and toxins. So the digestive system can be broken down into three areas: the upper, the middle, and the lower. In the upper section, there's the mouth and the esophagus. In the mouth, teeth begin the process of digestion by crushing food. Then saliva is secreted, which contains an enzyme that breaks down complex carbohydrates into simple sugars. And then the tongue mixes the food with saliva before sending the food down the esophagus. And the esophagus is a tube, basically, that prevents food or water from entering the body. But much more is happening while you are chewing and mixing. Your nervous system essentially is activated, and it sends a signal to the stomach to start making hydrochloric acid, which is a very strong acid. The middle section has multiple organs. There's the stomach, the pancreas, the liver, the gallbladder. Now, once the softened food from the mouth travels down the esophagus and enters the stomach, okay, so the food travels down and enters the stomach, and the lining of the stomach is essentially secreting this acid. And the stomach now is going to squeeze and churn the food so that the acid continues to break down proteins into smaller strands called polypeptides. peptides. And again, when food or water enter the body, or sorry, enter the stomach, it's not really going into your body. The stomach, you now can imagine, is churning, and it's making this slurry of partially digested food, and it's then squirted into the small intestine, and it's in this area that there's some very interesting biochemistry that takes place. Now remember, this slurry of food is very, very acidic, and what it does is it stimulates the pancreas to release some digestive enzymes, and these digestive enzymes further digest the proteins, carbohydrates, and fats. Now the pancreas also releases hormones that stimulate the gallbladder to squeeze its contents, and the contents of the gallbladder called bile, and this mixes in with the food slurry. Bile is a substance that's produced by the liver, and the liver is the place where biotransformation takes place. So when the liver makes bile, it also dumps all of these byproducts of biotransformation, these now water-soluble toxic substances, into the bile, and that's all mixing with the slurry of food. Bile is an important substance because it works like a soap, so it breaks down the fat molecules so that they can be absorbed. And now, while in the small intestine, the acidity there is still very strong, and what's interesting is that this acidity stimulates a hormone to be secreted from the intestine into the blood, and that will then travel back to the stomach, and essentially that hormone turns off the production of the stomach acid, and that completes the process for the stomach. Now, all functions of the digestive system, with the exception of biotransformation, take place in the lower area of the digestive system, where there are two major organs, the small intestines and the large intestines. So once the food is completely digested in the small intestines due to the acids and then the enzymes, then it's finally broken down into its smallest components. In other words, amino acids, simple sugar, fats, minerals, and vitamins. And now these components of digestion can be absorbed into the body through the barrier. So unless there's a breach in the barrier, only these nutrients are absorbed. So now everything continues down, and the absorption's going on, and continues down into the large intestine. And so the large intestine is where basically water is reabsorbed into the body, and as a result of that reabsorption of water into the body, the stool is formed, and then ultimately it's eliminated through the anus. Now the lining of the small intestine is very important. It has a protective layer of mucus that contains trillions of bacterial cells. And these bacteria provide nutritional and immune support. It's estimated that there are 10 times more bacterial cells in the intestines than the entire body. Some of these bacteria are replenished with food, but the majority, and this is important, the majority of the bacteria that we have in the gut are anaerobic, which means that they cannot survive in an oxygen environment. So these anaerobic bacteria, not the probiotics that everyone's familiar with, the ones that we take by capsules, these anaerobic bacteria originate in the intestines when they are passed at birth from the mother, and they are cultivated and grown as we age. And it's these anaerobic bacteria that are not replaced with food, but are depleted by stress, toxin, drugs, and antibiotics. So they're extremely important, and they are the majority of the of the beneficial bacteria in our digestive system. Now, also lining the length of the small intestines are tiny glands called Peyer's patches. And these glands are the guardians of the immune system, and they constantly test the digestive system for viruses, bacteria, and parasites. They make antibodies that amplify the immune system when foreign substances breach the barrier. So, and these, again, these Peyer's patches are lost as a result of stresses, toxins, drugs, and antibiotics. They lose their potency, they get downregulated, but we know that they can be rebuilt, and it's very important to rebuild them because of their immune function. Now, there's something else that I want to talk about that's connected to the digestive system, but is not in the same what we think of as the digestive system. That is the autonomic nervous system. The autonomic nervous system is your nervous system that's basically working behind the scenes. It's unconscious nervous action. You're not aware of what's going on. This is the nervous system that controls things like breathing, your heart rate. It controls how your stomach churns the food. It controls the release of certain hormones from the digestive system. It's very, very interactive, and it gets turned on and turned off by different things. It can get turned off by hormones, for example. It can get turned on by hormones. It gets turned off by stress. So what happens is the autonomic nervous system is essentially the way the digestive system communicates with the environment. And when the nervous system perceives stress, whether imaginary or real, whether it's emotional or physiological, it turns on these sympathetic nerves. And when these sympathetic nerves are firing, then all three sections of the digestive system stop functioning. So I just want to repeat that. When the sympathetic nerves are firing because there's a stress, then the digestive system basically stops functioning. And so for this reason, it's very critical for healing irritable bowel and any other digestive disorder that it's so important to monitor and alleviate stress from whatever source. Now, I wanted to throw this slide in. This is not one that I've shown for irritable bowel syndrome, but I think it's very important for our community here for Lyme disease. I found this picture one day when I was reviewing some slides for one of the classes that I teach in environmental medicine, and I found this because I was interested in why doctors were prescribing marijuana. So this slide came from the medical community, and essentially they say in the medical community that these symptoms of fibromyalgia are a condition in which doctors can prescribe marijuana. But this is really very important because these symptoms, when I looked at this slide, I recognized that this is really your body very imbalanced, what we call homeostasis gone wild. And if you look carefully at this slide, many of the folks who have Lyme disease or other chronic conditions, they have many of these symptoms. You follow that? When I move the slide, do you see it move? Or is it still on the screen? Just nod your head.
Yeah, it's still on the screen.
It's still on the screen. So if I move it like this, it doesn't change?
No.
Okay, good. All right. So, you know, many folks who have chronic conditions have some kind of central nervous system impairment. It could be anxiety or depression, sleep disorders, headaches. There could be pain in the body everywhere. There could be pains in the stomach. There could be nausea, joint stiffness. This is not just fibromyalgia. This is many people with chronic conditions. So what I see there is not fibromyalgia. I just see this as being imbalanced. I see this as homeostasis going wild. So let me explain what that means. Let's go back, for example, and just talk about symptoms of irritable bowel syndrome. So a common thread for people who have irritable bowel syndrome are multiple symptoms at the same time. It's not just one, it's multiple. So what would they be experiencing? They would be experiencing things like foul, smelly gas, painful and stabbing cramps, bloating, nausea and vomiting, right-sided abdominal pain, lower and mid-back pain, headaches, constipation, and sometimes that lasts 3 to 4 days with large painful stools, and lastly, urgency with loose mucousy stools. So what is going on with these folks? What's happening? Well, this is the way I see it. Basically, the digestive system is out of balance. And what does it mean to have a digestive system that's out of balance? It means that it lacks homeostasis. So I'm going to define this now. See, in medical terms, homeostasis is the condition when your systems are in balance and regulating normally, responding to and handling the multiple stressors that are just part of life. Now recognize that each person has their own threshold for handling stress, but stress can overload the system. And when that happens, the system is overloaded and it's unable to regulate itself. This dysregulation is communicated to you through what we call symptoms. So the digestive system has a very sophisticated regulation or communication system that has 3 parts. It has the immune system, the hormonal system, and the nervous system. I like to think of it as like a 3-legged stool. So when the legs are not the same length or very weak, it's hard to sit in a balanced way on the stool. So for example, we know that stressors can be emotional, physical, or spiritual, and these stressors will deplete the microbiome, the good bacteria in the gut. So these bacteria are a very important component of the immune system. And part of their role is crowding out pathogens like the bacteria E. coli or the fungus like Candida. So when stress suppresses the good bacteria, the immune system is weakened and the stability of the regulatory system crashes. And that's when we have symptoms. Now, drugs and medications can temporarily suppress symptoms while the underlying stressors continue to keep the digestive system out of balance. The stressors, as I mentioned before, are all of the above, physical, emotional, and spiritual, and are the obstacles to healing. So once these stressors are removed, then the body has a natural tendency to repair itself and return to balance. So in the case of irritable bowel syndrome, it feels like it's a never-ending cycle. Symptoms are the way your digestive system communicates that it's out of balance. The dysregulation of the immune system is the result of multiple stressors, and stressors are obstacles to healing and must be removed rather than suppressed. So the basic principle of naturopathic medicine is removing the obstacles to healing. Removing the obstacles to healing is the fundamental action that allows your body to find balance and healing naturally. So the obstacles are hurdles or blocks to heal your irritable bowel syndrome or, quite frankly, any other condition. All obstacles have a direct or indirect influence on the digestive system because they are a source of stress. Any stress on the body may influence the digestive system and become an obstacle to healing. So the most important thing is to remove the obstacles. So what are the obstacles? And I've identified 10 different categories of influences or stressors that are the obstacles to healing. And you can have one or any combination. It's almost an unlimited situation. But I've broken it down into 10 categories. I'm going to go through the categories one by one quickly with some examples. So the first one is infections. Let me find my notes. Number one, infections. So things like Epstein-Barr virus, the bacteria such as Borrelia burgdorferi, parasites such as Candida and Giardia. And so this category also includes chronic low-level infections from root canals, periodontal disease, and tooth extractions. So when you're looking for infections, it's not just in the digestive system, it can be in other locations that can be causing the stress. Number two, man-made chemicals. So this category includes such things as paint thinners, pesticides, herbicides, pharmaceutical drugs, and heavy metals like lead, mercury, and cadmium. Just as an example, it's known that the pancreas is essentially a sponge for pesticides. And so in the previous section, when I talked about all the functions of enzymes and hormones that the pancreas is providing as part of its function in the digestive system, if those things are changed because of man-made chemicals, then those become an obstacle to healing. Number three is lifestyle. Smoking, drinking alcohol, recreational drugs, little or no exercise, lack of fresh air, lack of sunshine, poor diet, and pregnancy. Number four is structure. So physical structure plays an important role in stress. So this category includes biomechanical problems like scoliosis or TMJ. You can have an obstruction of the airway or scar tissue from traumas and surgery. Number five, physiology. So poor absorption of nutrients, an acidic diet, too much protein, or too little fatty acids. Food allergies and sensitivities disturb circadian rhythms. Number six, natural toxins. So these are toxins that are produced and released by some very common molds and fungus. Number seven, biological inhalants, things like molds and seasonal pollens. Number eight, physical phenomenon like electromagnetic fields, microwaves, and ionizing radiation. Number nine, hormones. This category includes imbalances of steroidal hormones such as cortisol, DHEA, testosterone, and estrogens. And multiple stressors also suppress the thyroid hormone, the regulator of metabolism. And lastly, number 10, my favorite, emotional spiritual. And there is a substantial body of evidence, scientific evidence, that this category is the most important contributor to at least IBS, if not many other conditions. So things like post-traumatic stress disorder, unconscious conflicts, experiential stress. Ask your question, how are you with the world? Angry versus forgiving, fearful versus letting go. So obstacles to healing may be directly influencing the balance of your digestive system, or they may be influencing your health in some other way and indirectly stressing your digestive health by creating what we call total load. So it's never one stressor but a combination. In some cases, a few stressors may influence other stressors that creates what seems to be the never-ending cycle. Since each person is unique, personal investigation is necessary to uncover the obstacles that are influencing the digestive system and remove them from the total load. So what about a holistic solution or treatment plan for digestive problems, particularly IBS? There seems to be 5 interconnective strategies. One I've just talked about pretty much in great detail, and that's remove the obstacles. So the first strategy is removing the obstacles, and as we discussed, there are 10 broad categories of obstacles to healing IBS. There are several that are very common: emotional trauma and conflicts, infections, food allergies and sensitivities, quality of the diet. So if the diet is too acidic or contains too much protein, hormone imbalance, and particularly cortisol, because cortisol is a hormone that stimulates the sympathetic nervous system and thereby reducing levels of stomach acid and enzymes while slowing or stopping motility. So this is why stress becomes such an issue for digestive problems. Another common obstacle for digestive conditions are toxins like pesticides and herbicides, organic pollutants. You have to be careful with food colorings and preservatives in the water, and also antibiotics. Let's see. While you're putting in place this this strategy, in the short term, what may be necessary is to replace the digestive enzymes and some of the hydrochloric acid in the stomach until the digestive system comes back into balance, producing these factors on its own. The third strategy is to rebuild the gut with foods and supplements that contain probiotics, while also adding fiber and prebiotics to cultivate the beneficial bacteria. In other words, we want to grow the beneficial bacteria, the ones that come from the mother, and those are really, really important. The way that they grow is by feeding them, and we feed them fiber, essentially. We feed them prebiotics. Prebiotics is really another way to say fiber. We have to repair the gut. So I talked a little bit about the barrier as one of the functions, and so we have to take in really good nutritional support, maybe even some nutritional supplements to heal the lining and regenerate that barrier function. When the barrier function is breached, we call that condition intestinal permeability or leaky gut, and this creates all kinds of other problems, particularly autoimmune diseases. And finally, we need to repattern. What are we repatterning? It's very important to identify and change negative patterns of emotional stress with positive thoughts and affirmations. Negative mental patterns contribute to a catabolic or breakdown metabolism, while positive thoughts shift the metabolism to one that is anabolic and rebuilding. So those are the 5 strategies. You don't do them consecutively or sequentially. They have to really be done all at one time. So it becomes some real work. Of course, to remove obstacles, you have to be a detective or work with someone who can help you with that, and work with someone who can help with these other strategies as well. One of my passions is to teach people about natural medicine, holistic solutions, and I have a company called CAM Wellness Institute, and we started with a simple strategy of trying to put information on the internet that will bring into focus some of these conditions and strategies for holistic solutions and treatments. And we're trying to work with other camp practitioners, because there's no one answer when you work with holistic medicine. There's so many different solutions, and we want to be able to provide a place where people can go and see discussions about these different solutions. And so that's my passion, is empowering people by the excellence of science and the power of nature. So I hope this strategy works in terms of having these kinds of discussions in Google Hangouts like Jenny has put together today. And I really thank her for the courage of taking the courage to put this kind of thing together, and hope to do it in the future. So that was a lot of information. And,
yeah,
the only other face that I could see was yours. So.
Well, that's how this is. I guess set up. It's like the presentation, and then I can see people who are checked in, and like I said before, we have a pretty decent list of questions to go through. Thanks for putting that together. I think what I like about this particular format is, a presentation with visual is pretty handy. But if it's it's going to be posted on YouTube, and we'll post the video everywhere, so it's there to be reviewed as many times as anybody wants to look at it. And it is a lot of information, so it's something that can be looked at and stopped and paused and absorbed and re-looked at again, which I think is extremely helpful. And thank you to you. So I mean, you're very generous with your time. You have never once said no to contributing to the Lyme community. That there's so many people who just really need the information, and they can't afford to go and get help. So this makes a difference for a lot of people who are really struggling, and so it's great. It's exciting. We can make
I hope that we can just continue to provide this kind of outlet. It's great to listen to an audio, right? You get information that way, but what if you really have questions? By providing, on the screen slides that people can look at and say, oh yeah, I remember him saying that particular point, and then going and listening to the audio, and then you can take something like that, jot down some information, and take it to your doctor and talk to him about it, or her.
Right.
Yep.
Yeah, that's great. All right, so are you ready? We can go through the questions that we have.
Yeah.
These people have been submitting these over the last few days, and so I have a list, and we'll go through them and see how we are for time, and then if we have time left over and people have any additional questions, we can go to those.
Okay.
All right, so the first one was, for someone who deals with mold and MCS issues in addition to Lyme, which diet protocol would you most strongly recommend? Paleo, specific carbohydrate, Kaufman, SIBO or SIBO, SIBO, GAPS?
Yep.
Anything else listed there?
This is a very good question. So mold and multiple chemical sensitivities. So that's MCS. Okay.
Nice.
And again, this kind of condition really represents something that is way out of control. The person has not really been able to detoxify, so that's why they have multiple chemical sensitivities. They're just building up so many toxins in their body, and their immune system is so reactive to anything. This is the person who will walk out of their house and they can smell someone's perfume from 2 blocks away. They immediately get a headache and they're back inside for a day or so. It's a very severe condition. And yes, the Lyme bacteria can be part of this, because that bacteria in one sense is suppressing the immune system, because it's so overactive in other areas. The immune system is trying to deal with toxins, and then it has Lyme over here. So the immune system is extremely confused. So how do you deal with all of these things that are going on, and how can we shift the diet? Now, I've worked with diet for over 10 years now in my practice, and I have found that eliminating food sensitivities, reducing the amount of protein to about 50 grams a day, and lowering the alkalinity of the diet so that the diet is very alkalizing rather than acidic, that this diet helps all conditions. Because one of the things that happens with any condition, whether it's bacterial or it's toxins, the acidity of the body just keeps building. This makes it even more difficult for the immune system to get to the toxins, because everything is like sticking together and walled off. So you have to lower the acidity of the body, and the only way you can do that without taking a large amount of alkalizing substances or supplements is to do it with the diet. So I'm pretty sure that in a prior Lyme presentation, we talked about the ELPA diet, elimination, low protein, alkalizing diet, and we even posted a chart of the foods that range from acidic to alkalizing. So where does that stand on this whole list? Well, the diet that I'm suggesting is probably much closer to the Mediterranean diet. The Mediterranean diet is, a lot of fresh vegetables and fruits and seeds and nuts, and then grains are in there as well, whole grains. Remember, anything that's processed is converted to sugar very quickly, and that is very acidic. So whole grains are very important. So I think that's where I head with diet.
Right. I was just kind of trying to scroll down on. For those who aren't familiar with my website, it's lymethriving.com, and there's a page on there called teleconferences. There's a link to it, and all of our teleconferences are listed there with a link to the recording, and then any documents that were posted either by myself or the guest speakers. And Dr. Gruber was on there at least 3 times. I'm just trying to see here. I'll find it. It's a ways back, and before the end of the video, I'll just, or maybe between one or the other, after I found it, I'll tell you what the date is, because it's in date order. So the document you were talking about is posted on there. All right. Okay. So the next question was.
It's even more of the same, right?
Yeah, again with the multiple chemicals sensitivity.
In addition to Lyme.
Yeah, in addition to Lyme, if a person's dealing with Crohn's, IBS, leaky gut, Candida, Epstein-Barr, POTS, and weak adrenals, what order or items would you suggest prioritizing ahead of others in terms of treatment?
Yeah, this is a really good question from Pat. It's so important to heal the gut. You really can't handle the bacteria without healing what's going on there first. This is in biological medicine. This is the place that we always start. It's called intestinal rebuilding. You have to go in. You have to deal with infections, parasites. And then you have to follow the principles that I talked about in terms of repairing, replacing, and even, look, the person suggesting weak adrenals, that could easily be because someone has some kind of emotional stress, whether it's conscious or unconscious. So that has to be worked on as well. But again, healing the gut is the most important thing. And once that's done, a lot of these other things will rebalance themselves. Okay, I would say, for example, removing, eating a diet that's very clean, no preservatives, no food colorings. These are things that tend to cause flare-ups and Crohn's. So, again, you have to go through all of the digestive issues that a person has in terms of food sensitivities, and really follow the diet that I talked about just a few minutes ago.
Yeah.
The hard one in this whole list here, so I'll just read it again. Crohn's, that's digestive. IBS, that's digestive. Leaky gut, that's digestive. Candida, that's digestive. Okay? Look here, Epstein-Barr. Epstein-Barr is a virus, and that is, most people are infected with that virus. So why does it infect some people and not others? Well, because they have a person who has so much total load going on that it can't deal effectively with the viruses. So again, when you go in and you deal with the digestive function first, then it strengthens your immune system, and then your body can start to deal with things like Epstein-Barr. Okay?
Mm-hmm.
So that's a very good question. By far the most important priority is the digestive system.
Yeah. Somebody just posted a comment. I just wanted to read it. It has to do with this. She said, I listened to the autoimmune summit last week run by Dr. Myers. It seems like she and most of the functional medicine doctors were recommending paleo grain-free for autoimmune or chronic illness. Is that different to what you recommend?
Definitely. Paleo is a lot more protein, and it's very little in the way of carbohydrates. And I think that diet is actually a problem. And I think in the short term it may work, but in the long term I don't think it will.
Yeah. It seems like, I would imagine that each person, and I'm just speculating because I know I ended up doing what seemed to feel best for my own body, but everybody's going to be somewhat on some range in a scale. So, some people would do really well to have extremely low protein, and others might need a little bit more protein than somebody else.
But here's the problem. We know physiologically that we do not have the enzyme capacity to digest more than 50 grams of protein a day. So where does the extra protein go?
I don't know. Where does it go?
It's a good question, because a lot of it gets stored. A lot of it moves through the barrier, okay, because the barrier is leaky, so it moves through the barrier, and then it gets stored in your tissue. That protein in the tissue, and its storage of it, becomes like a sponge for your vitamins and minerals, because a lot of proteins have the ability to chelate or attract and bind minerals and vitamins. So you think you have this great diet, could very well have a great diet, but what's getting utilized? What's going into the cells? You see? And if there's too much protein in your tissues, then the likelihood is that you're not going to be getting a lot of benefit from the minerals and vitamins that you need. They just can't get into the cells, and that's where you need them. You don't need vitamins and minerals in your blood, and you don't need it in the interstitial fluid, or that fluid that bathes the cell. They have to be inside the cell to do what they're supposed to do.
Okay. Well, that makes sense. All right, we're ready for the next one?
Let's do it.
Okay. Can probiotics get rid of GI problems when you have low levels of H. pylori and sinus infection, Lyme, and co-infections?
Right.
She said, I know that gastrointestinal system is a great protector of immunity.
Right.
There's a lot of rumbling stomach.
Right. Yeah, this is a very common problem that we see with people who have GI problems. That is, they have sinus infections. So to clear up the sinus infections, you have to clear up what's going on in the gut. So you may have what we call as a dysbiosis, an imbalance of say too much candida or too much of a bacteria that is possibly leading to an inflammation. So the idea is to remove those and work on rebuilding. Again, here's rebuilding the immune function and the intestines, and that generally will take care of a lot of these problems. Now, I want to address this question about H. pylori, because I don't think it's really been settled yet. I have seen comprehensive digestive stool analysis. So that's a lab that I use to assess people's digestive function. And I have seen people with H. pylori in their stool with absolutely no symptoms. So there is theoretically, so it's not, I don't have evidence, scientific evidence yet, just clinical evidence, that H. pylori may be one of those innate part of our biology kind of bacteria, one of those bacteria that are always in our system, but it's our immune system that balances it, that the acidity of our system that balances it, keeps it low. I think when people are having problems with H. pylori, it indicates to me that there is an imbalance in their digestive function. Maybe it's too acidic, maybe there's too much protein, maybe there's not enough good bacteria, okay, to really balance everything, not enough fiber, maybe there's too much stress. Okay, so one of the things we know is H. pylori is a function of too much stress, emotional stress. Why is that? Because when you have a lot of emotional stress, your emotional stress, this negative stress, produces cortisol. Cortisol is a hormone that regulates your autonomic nervous system. And remember what I said before, too much cortisol activates the sympathetic nervous system. The sympathetic nervous system, when it's activated, turns off your digestive system. When it turns off, you don't have enough stomach acid, and that allows the H. pylori to proliferate. That was a long answer, but you see how it progresses, and why balance is so important. Okay, it goes from stress to your nervous system, or from stress to hormones to your nervous system, shutting down the nervous system, changing the level of acid, and now a bacteria like H. pylori will proliferate.
Okay. Great. All right, thank you. A lot of information. I would just find it really interesting how many different symptoms can show up when your intestinal health is out of whack. Because I know, when I was really ill, that when I had my worst brain fog and cognitive dysfunction, the brain fog in particular, every time my intestinal health was dealt with, it improved. It
improves, that's right.
Yeah, I would have never made that connection other than living it. And I would have done anything. All right, here's the next one. I keep hearing how important your gut is, but I took the road of antibiotic treatment. I keep hearing that it will ruin my gut and organs, which has me really concerned. I take probiotics, but still question the quality and of any brand, and wonder what else I should be doing. I love kombucha and kimchi and even kefir, but right now my diet is very limited because I have zero appetite.
Yeah. So the fermented foods that this person at Lori has mentioned are very important to provide probiotics to your system. Okay. Mm-hmm. But remember what I said about the other good bacteria, which is most of the bacteria is mostly things like, what are they called? Bifidobacterium. No, not bifido, sorry. Bacteroides. Bacteroides, okay? Bacteroides is a bacteria that lives in your gut, but once it is exposed to oxygen, it dies. So you can't put it in a pill. You can't put it in a supplement.
Mm-hmm.
So how do we get these things to proliferate and grow and stay vital? Well, they love to eat fiber. So when we eat greens, for example, let's say parsley or spinach, we chew it, we try to digest it, but we don't have the enzymes to digest the fiber, you see, in those foods. But that's where the bacteria come into play. They do digest it, and they then proliferate, they grow.
Mm-hmm.
So it's really important. That's why the vegetarian diet is very, very important to good digestive health. But I like the idea of actually making it into smoothies. So I like putting in greens into the blender and grinding it up. That way, I'm helping the bacteria to digest it. Okay? So they survive off of that. Now, in terms of bacteria, probiotics, these are the ones that they put in capsules. There's a lot of really good research, scientific research, that shows that IBS, irritable bowel, is protected and treated with bifidobacterium. So basically the two bacteria that are probiotics, lactobacillus or bifidobacteria. So the research is showing that bifidobacteria is actually the better probiotic for irritable bowel. So, you know, there's supplements out on the marketplace that have higher levels of bifidobacterium.
Okay. I think that answers the question that was following too, the insight into daily probiotic. Or maybe not. But yeah, do you recommend that, like daily probiotics?
I think it's very important. I mean, but it's interesting. I believe the science is really always changing because it's really relatively new. In clinically, though, let me speak clinically. I see people really have good results with higher levels of bifidobacterium. So that's how I treat people with gut problems. I give them a lot of high levels daily of probiotics that contain more bifidobacteria than lactobacillus.
Okay. Thank you. Okay, this next question was from Sarah. She wrote, I have searing, intermittent pain in my upper abdomen, immediately below my sternum, often accompanied by severe bloating and lots of gurgling movement. It started in 2010, and it sometimes presents for about a month at a time.
Yeah. What do you think?
Well, those symptoms remind me of when I had Candida.
Mm-hmm. It could be. It could also be reflux, right? So heartburn. So that's what you would feel right behind your sternum.
Yeah.
Bloating and lots of gurgling suggests that maybe not enough stomach acid. So everything is kind of sitting in the stomach and just fermenting, rather than being squirted out into the small intestine. You see. Mm-hmm. So yeah, there are a couple of things that I would want to investigate, but certainly maybe want to try a little bit more. Well, you can take bitters before a meal. You can,
what are bitters?
Bitters? Yeah. So, have you ever tasted dandelion leaves?
Oh, yes.
Bitters. They're bitter.
My
now,
God.
what do bitters do? Bitters stimulate secretion of hydrochloric acid. So that's why they're used in more traditional cultures, particularly Europe, they, on their way home for dinner, they're going to stop and they're going to get a little bitters. They'll have that, and then their digestion is already started. Now they have dinner. You see, that's the whole thing behind that cultural thing, and it works.
Yeah.
Yeah. The in the medical community, it's believed that heartburn and gastroreflux is due to too much acid. That doesn't really make any sense. So we tend to want to produce more acid and investigate why the esophageal sphincter, which is the constriction right before the stomach, is not holding the food and slurry down, you see, and it's splashing back up.
Mm-hmm.
Okay, so that's naturopathic medicine really investigates that.
Okay. All right, great. Somebody had asked, if you could please talk a little bit about Candida, the symptoms, and the best way to address it. I know that's one of the things that comes up a lot in the Lyme community, people dealing with Candida, and they can't seem to get rid of it.
Candida is very natural for everyone to have. It's just a question of why certain people, why it's proliferating so much, right?
Mm-hmm.
So there's all kinds of reasons that can happen. Not enough beneficial bacteria, too much acid in the diet, or not enough hydrochloric acid produced by the stomach. Too much refined foods in the diet, like sugars and flours.
Mm-hmm.
Even fruit, it can be a problem with people have proliferation of Candida. And when it comes to fruit, I found that people really should only eat fruit in the morning. That's when our digestive enzymes are the strongest to be able to break down those sugars.
Mm-hmm.
And so I try to get my patients to shift when they eat their fruit to before noon in the morning.
Okay, thanks. Okay, this question came...
There are many ways to address Candida, many ways, but you can't do just one thing.
Okay.
It's a whole program of things that you have to do.
Right.
And rebuilding intestinal function will really take care of Candida.
Okay.
And also, someone who has Candida really, and it's really not being addressed, it's no matter what they do, they have to consider looking at their heavy metal toxic load, particularly mercury, because Candida in some respects is very protective. It's one of the organisms in our body that absorbs mercury. So you can kind of think about what this kind of cycle that occurs with Candida and mercury. You've got mercury in your system, the Candida absorbs it, and then your immune system attacks the Candida to kind of suppress its proliferation, and when it does that, the Candida releases the mercury. The mercury then will suppress the immune system, and then ultimately that mercury gets taken care of, and the immune system starts to strengthen again, and you have this whole cycle all over. So it's really very important to check heavy metal load when it comes to Candida.
Okay. Okay. Let me see. This message was from Christina. She says, "My abdomen fills up with gas even if I only drink water. Could the Lyme be causing this? Doctors around my area could only recommend gas X, not a reason for it, and it's very painful."
The abdomen fills up with gas.
Even when she just drinks water.
That's it. I think that might be the stumper. Yeah, I don't see that. I'm having a hard time seeing that connection. This person has some kind of bloating that's going on, and there is really a complete imbalance of the digestive function, particularly from the very top, the production of stomach acid and the production of enzymes. So that kind of thing has to be investigated. I think what I would do with someone like this is have them do a stool specimen with a lab that provides you more of the digestive function. Do they have strong enzyme production, pancreatic enzyme production? That would be very important for me to know, because if it was weak, that would imply that either A, the pancreas is too weak and is not producing the right amount of enzymes, or B, that the stomach acid is weak and it's not stimulating the pancreas to produce the enzymes that it needs to make.
Okay.
So I think that's where I would head, and I don't think that Gas X would really do anything.
No.
It's more digestive function than, the thing that Gas X would do would be just to suppress the symptoms and not getting to the underlying cause of it,
Right.
the underlying obstacle.
Okay. So starting with a stool sample would probably be a good way.
And again, let's just talk about stress here for a second. There's some cultures in ancient days, whenever they would eat, they would recline. Take the stress off, right? Relax when you eat. Relax. Because, well, they didn't know it 2,000 years ago, but the reason that they did that was it was just perfect, because if you're stressed and you try to eat, you can't, your digestive function is not working. Remember, too much stress, cortisol. Too much cortisol, sympathetic nervous system. Sympathetic nervous system, turn off your digestion. So you're not going to make acid, you're not going to make enzymes, and your motility just stops or slows down. So relax when you eat. Breathe. Okay?
I can do that. Okay, thank you. So what is the scoop on magnesium and Lyme? I'm hearing don't take it and do take it. Here we get a lot of conflicting recommendations for care. So can you just talk about that a bit, about magnesium and people dealing with Lyme disease?
I'm not sure that magnesium has any direct influence on the bacteria itself. I think that magnesium is a really important nutrient for many biochemical pathways, particularly those that have to do with methylation and other biochemical pathways that affect mood, anxiety, depression. Okay. So one of the reasons why magnesium seems to be a very relaxing substance is because people have an imbalance in their methylation pathways, and in order to stimulate the removal of excess products of methylation, you need to have magnesium to support that pathway. It's very complicated biochemistry. I tried to make it as simple as possible. Magnesium is also important as one of the nutrients that we use, our cells use, to make energy. Okay? It's embedded inside the mitochondria, inside the I think it's the citric acid cycle. it's one of those things that when you're in medical school, you have to memorize it, and then as soon as you leave, you forget it. But it's in there, and that's why it's an important nutrient in the citric acid cycle. And so energy production is very important for everyone. If there's an imbalance in the way your body makes energy, and I'm talking about at the cellular level, because that's where your energy comes from. Every cell is responsible for making a certain amount of energy. So everyone's contributing to the whole, okay? So you feel energetic when everyone's contributing. But if everyone's not contributing, you're not going to feel very energetic, and you're not going to get things done that are supposed to get done. Everything that your body does, there isn't a single function that doesn't need energy. So that's why magnesium is so important.
Okay.
And there are good tests, not just only for determining the right levels of magnesium. So, you can test blood levels, for example. But you can also test functional levels, so that we know that magnesium, for example, is very important for X chemical to go to Y. So if you don't have enough magnesium, X stays in your blood, and then it gets peed out. You follow that? Mm-hmm. So without the right amount of magnesium, you see these byproducts come out that shouldn't be there. So what we do then is we support your system with more magnesium, and then those byproducts go away. So it's more of a functional way of handling how much of a particular nutrient you need.
Yeah. Okay.
So there's the scoop.
Thank you. You said that, and I'm like, the scoop on the poop.
Well,
it's a topic. We're talking about intestinal function. I think it does. All right. Is the common tailbone inflammation in Lyme patients related to intestinal bowel dysfunction? That was a question from Jenna.
I do think that if there is a inflammation going on in the lower bowel, towards the very end of the large intestine, and there could be a number of reasons that a person has that inflammation. So you could be diagnosed, for example, with a diverticula, which is a little pouch that would come out of the intestine, and it gets filled with bacteria, and it gets a little bit of an infection. So I believe that what happens is these low-grade infections in the lower intestine actually have an indirect relationship with the coccyx, the tailbone.
Okay. This is a question from Christina. She says, I have severe yeast, Baker's and Brewer's allergy. Should I avoid a probiotic with... Can you describe that word or say that word, pronounce it?
That's Saccharomyces.
Yeah.
Saccharomyces.
She said, I've heard mixed reviews, but my gut, pun intended, tells me to avoid them.
Yeah, I'm not a big proponent of Saccharomyces. The reason why we give Saccharomyces is because of the way it metabolizes and certain energy to your digestive system. So I like using, pretty much lactobacillus and bifidobacterium. And again, a person who has yeast, as you know, it's not just one thing. You can't just say, okay, you have yeast, probiotics. No, it doesn't work. It's got to be, a bunch of different things have to be in place in order to deal with this naturally. Otherwise, the solution is just to kill everything, with pharmaceutical antibiotics and antifungals. there's no one thing in natural medicine that's strong enough to handle one complaint. It has to be a combination of things.
Okay.
Mm-hmm.
Thanks. Another question here. Is intermittent intestinal paralysis related to general mitochondrial dysfunction and weakness, like clogged liver? Some patients have been told it's neurological. She's looking to understand the physiological pathology of this common issue.
Right. Well, we talked a little bit about that in the slides,
Yeah.
but refer specifically to what she's saying here: intermittent intestinal paralysis. To me, that sounds like more like slow transit constipation. Okay, and there is no one cause of that. It could be, too little beneficial bacteria, and those beneficial bacteria make the energy to make your cells do the work that they do. So it really, when you're doing investigation into digestive health, it's really important to work with someone who can do a comprehensive digestive stool analysis. They have really good tests now to determine the levels of the different bacteria that you have, and then you can begin to work towards replacing those bacteria. You're not going to do it all at one time, but if you change your diet, if you work with probiotics, if you put more fiber in your diet, particularly the kind that the beneficial bacteria like, so they like things like inula or arabinogalactin, and they like, the smoothies that we make with greens, that kind of fiber. Olive oil, very important for the beneficial bacteria, because they use that monosaturated oil to make the mucus that lines the digestive tract. That's why I think that this Mediterranean diet, where they use lots of olive oil, has shown to be so beneficial. Coconut oil too, that's another monosaturated fat. This kind of fat is what bacteria in your gut use to make energy and produce the mucus that lines the gut. You make this mucus, they make this mucus that lines the gut, and now the very thin skin underneath can repair itself.
Somebody wrote a question while you were chatting, and just thought I'd quickly read it before I go on to the last two that I have.
Okay.
Sandra said, if your body is breaking down protein, you have, just trying to understand the question. If your body is breaking down protein, you have no fat on your body and have had unseen blood in the urine, is it still safe to exercise?
Whoa. You have no fat on your body, but read the beginning again.
If your body is breaking down protein?
Oh, your body's breaking down protein. No. Okay, it's not safe to exercise. That's a very good question.
Okay.
Essentially, when your body is breaking down its own protein to survive, that means that it's catabolic, breaking down. Okay? Right. And so anytime you exercise, that's just additional stress on your body. Now, if you're in good shape, your hormones and your nervous system and your digestive system is all in balance, your immune system is in balance, then you're not going to have any problem recovering from the stress of exercise. Exercise is stressful. It turns on all of the stress hormones, turns on cortisol. It changes your physiology. It changes it to where it's more of your sympathetic nervous system. And when your body is converting, when your body is sympathetic nervous system is activated, it's very difficult to digest. It's very difficult. You have to be very careful because it's cortisol suppresses your immune system. So you have to be very careful with exercise. I would recommend maybe some walking, maybe a mile or so, or yoga, you know. Nothing that is really going to raise your heart rate to the point where you're you're really sweating. That's very dangerous for people who are too sick to handle stress.
Okay. That helps me to understand what she was asking too. Somebody just also posted, I'm getting like messages popping up in different places, so just bear with me. Somebody wanted to know, is it bad if there's a lot of mucus coming out? And I'm assuming that's in the stool?
Yeah, that's probably what they're referring to.
Okay.
You know, from time to time, people do eliminate excess mucus or mucus that's not really necessary. It can happen when you have a fecal material that has been sitting in the intestine for a long time. Okay, so but it should not regularly happen.
Okay. So sometimes it can happen if you've just taken a long time to move stool, but that it shouldn't be something that's regular.
Should not be regular.
Okay. Let's see. Okay.
That's actually one of the signs of irritable bowel syndrome.
Oh, okay. All right. Let me just see. She asked, what if your stomach is not absorbing magnesium?
There's many types of magnesium, and some are absorbable and some are not. For example, magnesium oxide, which is what is essentially Epsom salts, is not absorbable. It will make you have loose stool or diarrhea. So there are other forms of magnesium, like magnesium citrate, glycinate. These are chelated forms of magnesium which are more absorbable. Also, magnesium from vegetables is in a similar chelated form, so that's very absorbable as well. So some of your green leafy vegetables have lots of magnesium.
Okay.
I'm just trying to think the form. There's many different forms. You just have to have the right one.
Yeah. All right. We have a handful more questions. I think we can maybe get through them. Somebody asked, how do you regard coffee enemas, and are there other types you also like or prefer? Any suggestions as to frequency or otherwise?
The coffee enemas are very potent liver cleanses, and when someone is very toxic for whatever reason and is having difficulties reducing the congestion in the liver, coffee enemas are really good for that. In terms of frequency, I don't really have an opinion about that right now.
Okay. Okay. Somebody asked, have you heard of Restore? It is a fulvic acid used for gut inflammation. My PCP prescribed it a year ago, and it has done wonders for her. Or I don't know if you've heard of it. It sounds like a product.
No, I'm not aware of it.
Okay. Here's another one. A mom wrote to me. She has a 21-year-old daughter with a questionable history of Crohn's. She was diagnosed with Lyme 6 months ago. She has not yet started treatment and recently developed a rectal fistula. She's scheduled for surgery mid-December when home from college, but they're really hoping to find a way to heal without surgical intervention. Is this something that you have experience with? She had asked me that in a private message, and I said I didn't know, but if we had time, I would ask you.
I don't think it would be appropriate to talk about that. Okay.
All right. And then I have one last one. Boy, we're just like plowing through the questions. I've heard that H. pylori is the trigger and cause of a cascade of issues, including methylation. What do you think of the article? I don't know if you've seen. I don't know what article she's referring to, but it says, "What do you think of the article that is linked to the Yasko protocol and high pylori, H. pylori actually being the cause?"
Everyone is born with certain genes. You get genes from your mother, and you get genes from your father, and they come together, and that is your expression. There are a number of different genes for methylation, and it seems to me that there's no one answer, and that each person is their own individual expression. Methylation is a very complicated subject because it's not just the methylation that's important, but the byproducts of a methylation are just as important. So some people are very weak methylators. They also may have a weakness in other biochemical pathways that are affected by that methylation. And then they might have another polymorphism of their genes that affects yet another biochemical pathway. I don't see any connection between H. pylori and the way your genes operate. Now, there may be some evidence that that your genes are stimulated to do something, and it's not as effective as it should be because of your genetics. But the bacteria itself is not turning on or turning off the genes, as far as I know. It's a very complicated area. I think we're starting to uncover some very interesting biochemical pathways and ways to help people with nutrition rather than pharmaceuticals by looking carefully at these biochemical pathways. I hope that answers a little bit of it.
Okay, thanks. Well, it's 9:32. That was a pretty substantial amount of information in an hour and a half. Thanks for plowing through it with us. This is really great. We can do all different topics like this and get questions from the community and do some really great educational videos.
I think that's exactly right. And you know, even having the PowerPoint presentation ready to go, it was it's kind of like it's called like an online class in a way,
Mm-hmm.
you know, but it's a little bit more casual. And we could also have other practitioners where you could almost have like a roundtable discussion.
Yeah.
You know, it's not limited just to 2 people. You can have up to 10.
Right.
That would be fun.
Yeah, no, I'm getting really excited about the other opportunities. I know you did speak to me about this once before, and I didn't. My head wasn't quite in the game. I think I had a lot of things going on, and I didn't quite get the concept of what you were talking about. But now, thank you for and for sticking with it and saying we're going to do the Google Chat. So let's do a practice run because I was really ready to just say let's just do the teleconference. So this is great. We'll hear how this has worked for people too, and see what I think some people work, receive information and process it better when they can listen to it and also see it at the same time. So
and look, the format will have to evolve. That's all. I presented something here. I don't know. It may have taken 45 minutes, right? Maybe you want to have someone come on and just do, okay, just limit your presentation to 20 minutes. I really had no idea how long it was going to take. I just threw it together.
That's great. Anyway, I just want to thank you on behalf of everybody in the community because.
Thank you for asking me. That was really fantastic.
Yeah, thanks. Thanks for doing it again. It's always fun, and everybody really appreciates your time and all the information that you share. So I just want to say thank you again, and to everybody who is watching, watching us live, and anybody who's watching this after the fact. Thanks for tuning in, and my close for the evening is just know that however you are, you're perfect. And probably in about half an hour to 45 minutes, I'm going to post something onto the Lyme Thriving page on Facebook. Nice piece of music that you can meditate to. So thanks again, Gary, and thanks everybody for being here. And I'm going to say goodnight. So I'm going to stop the broadcast and see what happens next.